So thanks for being here. We got, Dr. Chan will be here to give us a quick update and again, an encouragement for continuing trying to get our booster shots as a preventative strategy for maintaining the pace that we're under right now in terms of keeping people safe and keeping our hospitalizations down low, and clearly it's important to the health of the state of Rhode Island. So with that, I'll introduce the doctor. And Dr. Chan, thank you so much for your leadership, your continued leadership, not only during the pandemic, before and now in this stage of our efforts. So the microphone's yours.
Thank you. Thank you, Governor. And good afternoon, everyone. It's a pleasure to be back. I want to thank the Governor for stepping up today and getting exemplifying good public health behavior and getting boosted. And thank you for trusting me enough to allow me to vaccinate you. As most of you probably know, this week, federal health officials authorized second booster doses of the mRNA vaccine. And so that means people can get the Pfizer and Moderna vaccines for certain groups of people. And those groups include people who are age 50 and older, people who are 12 and older who have compromised or weakened immune systems, and people who are 18 and older who got a Johnson & Johnson first dose and a Johnson & Johnson booster dose. All those groups qualify and are eligible for a second booster dose. After your first booster dose, you do want to wait at least 4 months before you get your second booster dose. For several months now, we've been strongly recommending people get that booster dose. The data has really showed that that booster dose is needed to protect us against emerging variants like the Omicron variant, like BA2, like other variants that are going to be emerging in the future. This is still our recommendation, is to make sure to get that first booster dose, which does increase your protection. If you are immunocompromised, I do want to recommend that you strongly consider getting this second booster dose as well. We know that people that are a little bit older, we know that people that have weakened or compromised immune systems are much more likely, unfortunately, to get severe illness and to die from COVID-19. For other people who are eligible for these second booster doses, my recommendation is to talk to your healthcare provider. Your healthcare provider knows you best and knows your health the best in your current situation. We are continuing to learn a lot about the protection that these vaccines offer in general, and especially against new variants. As we learn more, and as the data and the science continues to evolve, our recommendations may also change over time as we learn more. One of the ways that this is constantly evolving and recommending and changing is that some of these recommendations are becoming more individualized, and that's why we're recommending that you check in with your healthcare provider if you have any questions, especially if you're immunocompromised or have a weakened immune system. If you have questions about booster doses or vaccines in general, please check out our website, c19vaccineri.org. You can get second booster doses in all the places where you're able to get the first booster doses and other vaccines. We are in the process of updating our online system through c19vaccineri.org, and this should be updated very shortly. So in closing, for the best protection against COVID, against serious illness and hospitalizations, please get vaccinated, please get your first booster shot, and if you're eligible, please do consider your second booster shot.